Now, when it comes to this pandemic that we're living in right now, how has that affected people's ability to go out in nature and their health in general?
Yeah, that so it's interesting because what we're seeing more and more with COVID is that being outside is one of the safest places to be, much safer than being inside with a lot of people. And so it's been interesting to see a lot more people talking, especially when we were more shut down than we are now. A lot of people talking about spending time outside as the thing that was really helping their mental health and stress and anxiety. So I think having safe places to be outside is really vital for us right now as a country. I know personally, if I have days where I'm not spending time outside, I can feel it and feeling more anxious or more stressed. I think it also speaks to the fact that not everyone has equal access to clean and safe green spaces. So the other part of what I and my co-authors wrote about in this article is the need for more green spaces and how health systems can actually can and should invest in green space in their local community wherever they're situated.
How would you suggest they go about that?
So I think it's important to partner with the community, including CDCs, so community development organizations who are sort of on the ground and thinking about development in their neighborhoods, other sort of community leaders to figure out, what it is that the community wants, where they want it, and what that would look like. This certainly, something that comes up a lot in talking about this is gentrification. And greening should not be thought of as a tool for gentrification. And in fact, in communities that are already in the process of gentrifying, those probably are not the best places to institute new greening efforts. Rather, in communities that are far from gentrifying, where there is like the biggest need, where we're seeing the worst health outcomes from COVID or hypertension or other disease processes, those are the areas that probably need it the most. And so important to collaborate with community to make sure that you have the buy-in and desire from the people that you're trying to serve.
Are there any other steps for health systems or providers in being able to implement this idea of prescribing nature?
Yeah, there are networks like ParkRx of programs and examples of people doing this, and so I think there are lessons learned from that. That providers, if there was a healthcare office or a health system that was interested in implementing something like this. As far as health systems are investing a lot in social determinants that are, for the most part, really addressing immediate social needs. But I think we really need to still develop the model of what it looks like for health systems to invest in greening and other sort of infrastructure changes.